it up here. It is so gorgeous. Look at this. It's got like a cute little play area. How adorable is that? You're about to smile and style. This place looks like a spa. I'm looking for the doctor.
Hello.
Hi.
Hello, I'm Dr. Bath. Thank you very much for coming here. And let me show you around. Come.
So beautiful.
So this is our waiting area. And we're still working. And this is our machine over here where we take some x-rays. And yes,
Wow.
this is a 3D machine. We can see airway in this, we can see TNJ, we can see bone in 3 dimensions, we can even do self-analysis over here, which means to look for if you are a candidate for braces or aligners.
Wow.
Let's go over here. So, this is our consultation area where the patients will sit and we'll talk about their treatment plan. These are the operatories. So these operatories are well equipped and has the latest technology. We have the latest design of chairs, very comfort, luxury added, and yeah.
So you have x-rays in all of these rooms as well?
Yes, it's already there.
Yeah,
which
that's
means-
so cool.
Which means it's hidden behind this.
That
So
is
that's
crazy.
it.
In all the rooms, wow.
All the rooms. And let me take you further. Here. So this is one of the rooms.
Which one? What is
This is
that for?
our
That's the
lab.
bank account one, no?
Beautiful.
So in this lab we have 3D printer.
So what all do you
We
do?
make our own crowns in office.
That is amazing.
And this is a machine to clean teeth. This is the latest technology. We don't scrape teeth. We just have a modern way of cleaning teeth.
So it's really comfortable?
Yes, and this is a facial scanner. We basically scan the face for when we are doing dentures or anything like that. So
Wow.
that means we simulate the smile with whatever teeth they are getting. So we can create the smile while we are, making them any kind of restorations.
That's
Which means
amazing.
crowns, dentures, partials, whatever they want.
So this one does crowns?
Yes, this makes crowns.
And then what do the other ones
And
do?
these are the 3D printers. So we basically can print anything. We can print surgical guides. We can print anything. Even dentures, everything.
Wow, that's incredible.
And this is the scanner we use to scan. And we use this to scan teeth. And once we scan it, then it automatically comes in this machine. We design it here. It comes in this machine, it fabricates a crown, and then we glaze it, which means we cook it in the oven, and then the crown is ready.
That is amazing.
Yes,
Usually people have to wait like weeks in between that kind of stuff.
Yes, I know that it's just how it is.
That is so fun.
Let me take you to this. This is also one of the labs, and we make sure that everything is washed before we leave. They have to take off their uniform and wash it here.
And then this is like PRP?
Yes, this machine is for PRP, PRF. That's what we use it for.
Now what's the difference between PRP and PRF?
So PRP is platelet, F is fibrin. So basically that's the difference. And
Okay, F is what?
fibrin.
Fibrin. Okay, so what do you use the PRF for? I've heard of PRP.
So basically these days, there are a lot of applications for PRP and PRF. Basically PRP is usually used, how I was using it is for microneedling.
Okay.
We draw your blood and then we centrifuge in a machine and then we basically kind of use it while we're doing microneedling. but PRF actually is used as a filler also. These
Oh,
days,
okay.
people are going away from artificial fillers and they want to do natural fillers, and so PRF is used. Basically, it's more of collagen, more of fibrin. It just gives volume, and it's your own blood, and so you don't have to be worried about that anything is artificial or something which will not be compatible with your body. So it makes a huge difference when you use your own body or your own blood to have a benefit of it.
Yeah, that sounds a lot safer.
Yeah, definitely. So this is our surgery suite, and this is the laser, one of the lasers.
Yes, I wanted to ask questions about this laser.
Yeah, so this laser is the very, it's the best laser in dentistry. This laser is used for a lot of things. We basically can cut teeth with this. We can even, contour gums when sometimes people have short crowns,
Yeah.
big crowns. We can change the gum, how it should look. We basically develop their smile line, and then we also use this laser to shrink the soft palate when people are snoring and they don't
Wow.
like snoring. So we correct that snoring with this machine too. So it's FDA approved for that, and yeah. good results.
So with the snoring, I know a lot of people as they age, they have issues with sleep apnea. There's like oral devices for that, right? Are there any applications you can use with this laser to help with the sleep apnea like it can with the snoring?
So ideally, we cannot say that this machine can cure or prevent or can do anything with sleep apnea.
Okay.
It's just it's a broader term, sleep apnea.
Okay.
It can be treated by physician, but now these days, dental sleep medicine, you need to be certified in order to do sleep patients, which I am, and that's what I'm working on too. But this machine is fairly focusing on snoring.
Okay.
Which means that when we use this laser on the back of the palate, it shrinks the palate, opens the airway. So it definitely is an adjunct therapy for helping with sleep patients, and they sleep better, they have better air going in, they have more airway open, but we cannot ideally say it that it can correct sleep apnea.
Okay.
It can only do snoring, which we have seen huge results with a lot of my patients. They just love it. And the another application which I do with this laser is that I have seen a lot of my patients when they have cheek bite. And since they have a cheek bite, they keep biting their cheek.
Yeah.
And it just keeps coming between the teeth and it bothers them.
Yeah.
And it hurts them. So with this laser, when we use it, we can basically eliminate that problem too. And they don't have cheek bite, and it shrinks the tissue and it makes it easier for them. And cheek bite completely goes away.
That is so cool. So can this do anything for TMJ?
Direct application, no.
Okay.
Yes, but there are diode lasers which
Okay.
can do a lot of things for TMJ. So TMJ basically, if you're using laser, you just can reduce inflammation. That's the
Okay,
only thing.
okay.
So you need to use a diode laser. This is a carbon dioxide laser, which is basically
Okay.
the higher version of
Yeah,
lasers.
intense.
And, yeah, it basically kind of works at a higher level.
Yeah.
So that's why we cannot use it directly for TMJ, but
Now,
definitely.
do they have any lasers that can grow back gums, or do you have any toys that can do that yet?
So not right now. As I told you that PRF,
Yeah, that was
those things can help basically.
Really?
Little bit, but the application is still coming in.
Yeah.
Anything that comes up in the market or any gadget which is made in the market that has to go through research. So
Yeah, for sure.
definitely it's under research.
Future applications, that
Yes,
could be a
yes.
possibility.
So as doctors, we cannot use any application unless it's approved.
Right.
Unless it has gone through research.
Of course.
Until there is a proven fact about it. And
Yeah.
That's how we use it.
I love that. We've learned so much today, and we're gonna have to come back for part 2 of the tour. And I know we're gonna have a lot more questions. We are gonna be having a live stream here where you can ask all kinds of questions. We're gonna put a future date on that, and we'll see her at the spa soon.
Yeah. Thank you.
Bye.